I work in an industry where I will stand on my feet on concrete for sometimes 20 to 40 hours a weekend, and it just started as a numb pain in my knee and got to the point where my knee felt like it was starting to lock up, and with such a sharp pain, I had to start employing knee braces just to get around. It was something that started, and I pretty much put up with it as it progressed over the course of like 6 months, where it got to the point where it was almost unbearable. Sharp pain, and I'd turn a certain way or maybe bend to pick something up in my booth at the conventions I work, and it would be like, you know, just like being stabbed with a sharp poker in my knee, and it got to the point where now this is not going to work, and I got to be able to just keep doing what I'm doing now because of this pain. The procedure was actually just really quick. I, of course, got knocked out during it, so that made it really quick. But it was walk in the office, get prepped. The doctor did what she had to do. I woke up, an hour or two later, and it was done. Well, a year and a half after having it done, it's totally changed. At first, it was, you know, just like anytime you have an injury and you're starting to go back on it, and you're not sure, is it really gonna work? Am I gonna step wrong and that pain's gonna return? But that never happened. I did what the doctor had prescribed as far as rehabilitation exercises and stretching to rebuild the muscle in there, and it's been great. I've been able to operate and work as normal without the same kind of pain I was experiencing prior to having the procedure.